Honestly, there's a lot of emotions that come with
Yeah.
that. People get really afraid. They get afraid of the longevity of what that could look like.
Yes.
It is a crisis of identity to have an injury because you're stopped from being able to do the things that you normally do.
Yeah.
And it causes panic for a lot of people. I mean, we have patients coming in all the time who are really panicked
Yeah.
about what's going on in their body.
When it comes to health, we're all going to have to go to a physician. We're all going to have to go to a practitioner, right?
Yes.
Something that we've become really passionate about is whose chair you're sitting in, right? It
Right.
matters.
You mean in terms of like a practitioner?
What modalities that practitioner has to offer you in terms of how they can take care of you and address your health problem, your chief complaint, why you're there.
The tools they have to offer.
It's so important that you know whose chair you're sitting in.
Yes.
And what they are going to potentially offer you.
Yes.
Because maybe you're somebody who doesn't want to take a prescription drug, but you go to your PCP for X, Y, or Z, and they offer you a prescription, and then you're all frustrated. But that's what they have to offer you.
Right. That's their toolkit.
That's their toolkit. If you're somebody who that's your ammo, great. You're in the right chair, right?
Right.
But I think that we talk to a lot of people about whose chair they're sitting in and being really deliberate and intentional about knowing what kind of treatment you're up for, right?
Right. And, when somebody gets hurt, they get sick, they get injured, they're dealing with either an acute or a chronic issue. Honestly, there's a lot of emotions that come with
Yeah.
that. People get really afraid. They get afraid of the longevity of what that could look like.
Yes.
It is a crisis of identity to have an injury because you're stopped from being able to do the things that you normally do.
Yeah.
And it causes panic for a lot of people. I mean, we have patients coming in all the time who are really panicked
Yeah.
about what's going on in their body. And when that happens, it is a rush to figure out the solution.
To fix it. The threat feels
To fix it.
so big to them. Something's really wrong with them.
Yes. And so whoever they might get directed to first, whatever kind of practitioner, that practitioner is going to offer them solutions. And a lot of patients are like, done, like, that's it, fix me.
Yep.
And what ends up happening for a lot of people is they end up being frustrated because one, the solution is not what they were looking for.
Right.
Or two, it didn't work well for them. Or three, it's something that's just not sustainable.
Right.
And so what we talk to people a lot about is, listen, you're going to have an injury. With this specific injury, every practitioner that you see, every kind of person is going to offer you different solutions.
Yep.
And the goal is to figure out who to start with and then figure out what order or what process you go about finding the solution to your issue.
Yeah.
And it depends on a lot of different things. It depends on, the severity of the problem. You say all the time, for acute emergency situations, Western medicine, they're like the firefighters.
Yep.
They come in, they save lives. They've got emergency surgery. If somebody has severe bacterial infection, you absolutely need to go to the hospital and get antibiotics,
Yep.
right?
They're really good
Acute
at
care.
Emergency medicine. They're really good at saving lives.
Yes.
They're really good at putting things that are broken back together.
Yes.
That's what they are excellent at.
When it comes to chronic injuries or prevention in healthcare, is Western medicine always going to serve people in the best way? A lot of times their toolkit is, somebody comes in with pain, it's pain relievers, muscle relaxers, rest, and a referral to a physical therapist,
Yeah.
right?
Yep.
If somebody has shoulder pain, they might go to a chiropractor. A chiropractor will, do a skeletal adjustment, maybe some soft tissue work, and they'll recommend ice and maybe some massage. You go to an acupuncturist for shoulder pain. They're going to do trigger point. They're going to do points for pain and inflammation. You go to a massage therapist. They're going to do manual therapy with their hands. You go to a physical therapist. They're going to do exercises and stretches.
Yep.
It's different tools for the same problem. And what matters is what is the patient comfortable with based on how serious the problem is? And is it something, what order to go in?
Right.
I think what we see a lot is people get scared and they think worst case scenario.
Yeah.
Based on our fear of being injured or being ill. And so, whoever is going to offer the first solution, that's what they go with.
Yeah. And it's important to really, again, know what you're up for and maybe start with something less invasive.
Yes.
Maybe start with not the worst case scenario, because that's kind of where we all go, right?
Yeah.
If somebody's shoulder's hurt, they say, something is so wrong with me, I think I need surgery. That's what they're envisioning. The threat to them is so high. But likely they just pulled a muscle, and a little bit of soft tissue work would go a long ways. And it does, because that's what we see in our clinic. I say to people all the time, what we do is like a reverse diagnosis, right? If I am working on your muscles for your shoulder, and you are getting better in my care, every time you come back to me, you say, Sarah, I was better, 30 to 40 to 50% better for 1 to 5 days.
Yeah.
That tells me that it's something not more structural.
The treatment is working. Things are progressing.
Your muscles are relaxing. You are getting better. If you are getting no better, that's when I am going to raise a red flag. And I'm going to think to myself, what else could be going on?
What kind of structural issue could be happening?
Right. And what kind of imaging are we going to get you? Are we going to get you an X-ray? Are we going to get you an MRI?
Yeah.
Do you need to be in a surgical office? Because we need to know that there's something not more severe going on.
Yes.
And I do not hesitate to refer to a Western doctor.
No.
At the drop of a hat if I see that somebody is not making progress in my clinic. But I say, this is a great place to start. Give me 2 or 3 times and I will know if this is soft tissue or if this is something more, right?
Yes.
And so I think that starting with something less invasive can be so much less stressful and dramatic, and actually more often than not give you a really great result.
In general, most people do respond to the less invasive therapies unless there's really a serious injury. But, a lot of times people just don't know about other options or other treatments.
Yep.
And so, they're left trying to figure it out, and it gets really confusing.
Yeah.
The other piece to this, and hopefully, and I think that this is becoming a bigger part of the conversation in the medical field, but having people really trust their gut, their intuition about their bodies and their health, and encouraging them to be an advocate for themselves.
Yeah.
If they are not feeling like something is being addressed well, or if they're not really sure about a solution, or if they're hesitant to take pain medications, which many people are, or, other types of prescription medications, a lot of people are really hesitant to do that, and especially initially.
You gotta listen to yourself.
So be an advocate. Don't be afraid to ask for a second opinion, to seek out other options, to learn more about a condition.
Yeah. Gain
information and awareness about what's going on, and, go out and talk to other people about what kind of tools could they offer you.
Yeah. That's what I was going to say. Talking to friends and family about people who have had similar conditions as to what you're going through and what they did and what has worked for them, and practitioners that they trust, I think can be really helpful. You have options. And I think for a lot of us, we haven't had something happen to us before. And so we don't really know what to do, right?
Yeah. And when it happens, it's scary as hell.
It's really scary.
Yeah.
And so I think that just knowing that you have options, knowing that all these practitioners are going to treat you a different way, and you have to figure out where you want to start, right?
Yes.
And we think that usually less invasive is if it's something that's housekeeping, right? So housekeeping, we're talking about quality of life. Things that you can live with but wouldn't choose to. So we're talking about shoulder pain. You're not dying. We're talking about low back pain.
Knee pain.
Yep, knee
all
pain.
Kinds of pain.
All kinds of pain. We're talking about all the pain. We're talking about anxiety and depression. We're talking about insomnia and allergies.
Headaches.
Hormonal swings.
Digestive issues.
Yep. these are all what we call housekeeping issues,
And
right?
a lot
Quality
of those things
life.
are chronic, right? You know, if you have a severe migraine that is out of the blue, super acute, you've never had anything like that before, it's absolutely appropriate to seek out emergency medical
It
care.
is, because it could be something that is very dangerous for you.
Yeah, but if you are somebody who has chronic headaches, you have for your whole life, that's something that can be worked out potentially with somebody who's working more along the lines of dealing with chronic issues and talking about prevention.
Right.
And I think that this is really just about education
Yeah.
and informing people. There are so many different modalities and so many types of practitioners, and every single one of those people has a place at the table
Yeah.
in terms of medical treatment.
Yep, they do.
And they all complement each other.
Yep. That's something that I think was really passionate about right out of grad school, is that I really believe that we all do complement each other. It's just about patients knowing who to go to for what condition, right?
Yeah, and ultimately, I mean, maybe in this ideal perfect world,
We would all work together.
people would be communicating more and more across medical industries and really creating an integrative medical setting,
Yeah.
which happens, you know, in small pockets, and it's beautiful and it works really well. And, you know, that's kind of my hope and vision for the future, is being able to see that happen for people.